Good morning, everybody, and welcome to this webinar on why now is the right time to talk about mental health. It's a very timely topic, I think, given it's a year since we all locked down due to the COVID-19 pandemic. I'm Paul Wilkes, the FORS Business Services Manager, and I'm delighted to say that I'm joined today by Martin Lockham, the Growth Development Manager for Mates in Mind. And this is the second in a series of webinars where we'll introduce you to one of our FORS associates, so you can find out about some of the best practice to help you manage your fleet, as well as some of the offers and discounts that are available to you. Click over to that. So while I've got you here, I just want to take this opportunity to remind you all about FORS Associates. Now, FORS Associates are companies who offer discounted products or services to FORS operators. And you can see a list of the type of areas that they cover here. You know, we've got everything from vehicle safety, training, telematics, fleet management, through to healthcare and insurance, and many, many more within that. And you can find the offers and discounts that they provide from our more than 150 FORS associates by going to your members dashboard and then click on the browse products and offers, and you can see on the right hand side. Yeah. So that's my bit done. I've just stolen a few minutes from the start of Martin's presentation. So just before I hand over to Martin, I'll just say that in the usual fashion, if you've got any questions during the presentation, then please use the question chat box on the right hand side of your screen. We will take some time at the end to answer any of your questions. So I'll now hand over to Martin to take you through the main presentation. Before we do that, we'll turn the cameras off so that we can focus on the slides. So we'll turn cameras off now and I'll hand over to Martin. Thanks, everyone.
Thanks, Paul. Morning, everybody. Thanks for joining us this morning. I'm Martin Lockham. I'm from the charity Mates in Mind. We are a mental health charity that predominantly works within the construction and transport and logistics sectors. We focus on working with organisations to help them improve the mental health of their employees. Today we've got a few areas to run through, but what I thought we'd start with is by looking at what we actually mean by mental health, because we all have it. Everybody has mental health. We have good mental health, poor mental health. You can have a mental illness but have good mental health. You can have no mental illness but have poor mental health. It's very similar to physical health in that it varies from a day-to-day basis, but we all have mental health. We have really three kind of core areas of mental health. So we have mild, where a person can suffer from a small number of symptoms that have a limited effect on their daily life. So it might be a small amount of anxiety in a day that doesn't really impact hugely on their daily life. Moderate mental health is where someone has more symptoms that can make the day a bit more difficult than usual. And obviously we have severe mental health, where a person has many symptoms that can make their daily life extremely difficult. Again, though, a person can experience these different levels at different times of the day, week or year. Now, mental health, it can affect any of us at any time. Short-term distress can impact anybody at any time, basically. 1 in 6 employees in any week will have or suffer from some form of common mental health issue, predominantly from stress. And 1 in 100 people will be diagnosed with a significant mental illness over the course of a year. And again, what really influences mental health? There are 3 core elements, and again, there's no real specific way of saying it will be these areas that cause a person to suffer from poor mental health. But the 3 areas that we look at: biological, so things like chemical breakdown in the brain, injury, physical health, age, things from psychological side of things, so beliefs, value systems, suffering from grief, relationships, and also social. So again, obviously through COVID, we've seen a lot of people suffering through isolation and loneliness, but it's a makeup of these 3 elements that can affect a person's mental health. So these 3 things can be affected by the pressures that we all face on a daily basis. And if you can just take a moment to think about pressures that you might face at home, firstly, that could affect your own mental health. Some of the most common ones that we see, obviously, are financial concerns, health problems. Childcare has been a major issue for people through COVID, with the situation that we've all faced. This has had an impact on people's relationships, and obviously we know the tragic situation with COVID bereavement has been really intensified. We know that people have been caring for family members. People have been isolated away from their family, and so there's been a huge amount of pressures that we all face pre-COVID, but also these have been amplified, as you can imagine, through the pandemic. Again, if you think about the pressures that you face at work, the two do interact. They're not separate things. You take some of the pressures from home to work and vice versa. And obviously some of the things that we tend to see are job security, uncertainty about the future is a big one at the moment. Personal nature of work that they work in, deadlines. We speak to a lot of van drivers, obviously, that have seen over the last 5 years their deliveries, daily deliveries, drops increase almost twofold. And so that brings a pressure from the deadlines and the stress of actually achieving those. A person's working environment, problems with colleagues and managers, and obviously a degree of control that you have on your job can all affect a person's mental health and how they actually deal with those stimuluses and situations. They all have an impact on individuals, and unfortunately, 2019 saw a 2-decade high for suicides in England and Wales, with almost 6,000 people taking their own life. Suicide is the #1 killer of men under the age of 45 years old. Not cancer or illness, it's suicide, tragically. In transport and logistics, we see, according to the ONS, that HGV drivers are actually 20% more likely to take their own life than the average population. And for warehouse operatives, this increases to 85%. And we're doing a lot of work to try and work out and uncover what are the issues that are driving this within the sector, the industry. We see a lot of similar statistics within construction, and so obviously we're trying to work with the industry to actually understand that a bit more and how we can make relevant interventions to help the sector. Worryingly, only 27% of people who actually do take their own life have been in contact with a mental health service in the year before they died. So again, it highlights that people aren't talking about mental health enough. They're not reaching out for the support often enough until it's too late. COVID I've touched on already, but it's obviously it's been a major thing over the course of the last year now. The Centre for Medical Health are estimating that at least 500,000 more people are going to experience mental ill health as a result of COVID. And some of the statistics that they've started to see are that 50% of people feel more irritable, 54% are more emotionally exhausted, almost 70% of people are experiencing higher levels of stress. If you relate that to work, a lot of organisations, unfortunately, have had to downsize, and so there's more pressure on smaller teams to perform at the same size level. So there's a lot of stress and pressure on individuals. And overall, 42% of people are reporting that their overall mental health has declined through COVID. A recent survey of Unite reps, again, just to reaffirm that, has shown that one of the areas of increased issues dealt with by Unite reps is mental health. They've seen a 64.6% increase in cases of people reporting poor mental health within the workplace. So again, we can see that there has been a really, really big impact. There was already an issue within sectors prior to COVID, but COVID is having a real impact on individuals' mental health. And obviously from a business perspective, we've reported already that 1 in 6 people will suffer a form of mental health condition during the week. The HSE actually report that 54% of all working days lost can be attributed to stress, anxiety and depression. And so if we can obviously work to improve that statistic, that's going to be a benefit to business. Transport and logistics sector is one of the highest sectors of lost days to unplanned absences. And it costs, according to the recent Deloitte report, almost £1,375 per employee per year. So if you can imagine the size of your team and the lost days as a result of poor mental health, again, anything that we can do to improve that is going to help the business's bottom line. Worryingly, again, due to usually the stigma around mental health, and it's especially prevalent in male-dominated workforces within construction, within transport and logistics, 60 to 90% of employees will give a different reason for their absence. And that's largely because people don't feel comfortable, or that their workplace is an open enough culture to actually admit or say, I'm feeling stressed, I'm feeling anxious, and that's the reason that I need time off. A recent survey by the CIOB across just over 2,000 employees found that 97% of employees will experience stress at some point in time, 87% of employees experience anxiety, and 91% of people felt overwhelmed. It affects 95% experience poor concentration, and obviously for the transport logistics sector and for fleet operators, that's a worrying statistic. Poor concentration to a person operating a 44-ton truck really isn't what we want to see. And so we really need to kind of address that issue. The working environment obviously as well has a real impact on employees. I know that one of the real highlighted areas of concern within logistics and transport recently has been a lack of facilities or facility standards up and down the country. And 71% of manual workers found that a lack of facilities has an effect on their stress levels. 94% of people are now experiencing stress due to time pressures. So again, those daily deliveries that have almost doubled over recent 5 years, particularly for van drivers, when you think of the Amazon culture and making those deliveries, you know, speed limits haven't increased. People are having to cram a lot more in a lot more quickly now. Almost 70% of people found uncertainty in work locations stressful. So obviously arriving to make a delivery or make a collection, if you're held up there, you don't know who you're going to be dealing with, you don't know what the conditions will be like of that work location. We saw through COVID that unfortunately drivers were being restricted access to facilities on sites. So that causes, again, a stressful situation for individuals. And we know that 70% have experienced moderate to extreme levels of stress due to poor communication within an organisation. So what are we seeing that organisations are actually doing about mental health at the moment? Well, pleasingly, we've seen that there's been an increase really in organisations providing helplines and mental health first aiders within the organisation. That's really important and really critical that people have got somewhere to go, but that is very much a tertiary measure. And so that's aimed towards actually dealing and supporting somebody once they've reached a stage that they actually need that support. As a charity, what we're asking people to do are consider the secondary and the primary measures around mental health. We can see that of that recent report, the CIOB, 71% of individuals reported that they'd received no mental health training in the past 3 years. And so whilst it's great that we've got mental health first aiders and we've got helplines provided, if people aren't aware of mental health, be that themselves or others around them, then they're less likely to actually make use of those services. So it's really important that people have a basic understanding of their own mental health and those around them. And again, then primary, what we really want to see are organisations addressing the source to contributors of mental health, so the stresses. So we can see pleasingly that over 50% of companies now have mental health policies in place, but worryingly 31% of employees think that their employer would treat a mental health issue not particularly seriously. So again, it's very much about that cultural piece. How can we make our work environment more open to enable people to talk about mental health? Quite a wordy slide, this one. There are 6 core standards to mental health within the workplace. I won't run through all of those, but just those 6 standards really you can see are prioritising mental health at work. So putting a plan together, having ownership of mental health, and actually monitoring your employees' mental health and well-being. We're looking at positive work design and cultures. So is it a good working environment? Are we taking employees' feedback on board? And are we always looking to impact the workers' culture? We'd like employers to promote an open culture around mental health, and that means increasing awareness and challenging the stigma of mental health in the workplace. Encourage two-way conversations about mental health, from one-to-ones through to team meetings to senior management meetings talking about mental health. And we want people to increase confidence and capacity so that they can support each other and have increased mental health literacy for all staff. Equip those staff to actually have conversations together about mental health. And crucially, managers play a really important role within the workplace. If their attitudes towards mental health are so what, it doesn't matter, it's not real, then that's going to be cascaded across the business. So it's really important that managers understand the role that they play in providing mental health support to their employees. We want people to provide work tools and support, so raising awareness using tools that are available, and try and tailor mental health support within the organisation. And finally, increase that transparency and accountability. Identify and track key metrics. Report internally and externally what you're seeing, and measure the actual activities that are being done within a framework. Standard 3 and 4 for us are the really key ones, because if we can really get people talking about mental health, that is going to create that open culture where people feel more empowered to actually speak about mental health. And ultimately, our people are the front line to worker well-being. They're the guys that you're most likely to speak to. So you are likely to speak to your friends, family, and your close work colleagues. And so if we can get people feeling that actually this is an open culture, I'm encouraged to speak about mental health in the workplace and to my colleagues about that, we're going to be able to break down some of the barriers to support. We know that first and foremost, acknowledgement of mental health, your own mental health, is often a difficult thing. And often people actually spot the signs in others before you recognise it in yourself. So it might be a behavioural change. It might be that someone's more quiet than usual, or a bit more extroverted than they normally are, or they've been missing from work for a couple of days, usually for them. And so it's often others that spot that in themselves. We've touched on stigma, and we'll talk a little bit more about that shortly. But especially in male-dominated workplaces, there is a real concern that speaking about mental health and acknowledging that you're struggling with things is a sign of weakness when it really isn't. There's a worry about the perceived benefit of revealing that you're struggling. You know, will I be pigeonholed? Will I be put in a box and not considered for promotions within the workplace because I've admitted to having a mental health condition or concern? People are worried about confidentiality. If an organisation has a mental health first aider, will they go and speak to that person if they don't know that person particularly well? Are they worried that what they reveal is going to get back to senior management or their bosses? And so does that confidentiality stop people from actually reaching out to support? And is it the right time and place for people to actually speaking about that? And that's why we think it's so important that we encourage people to actually talk more and everybody have that open culture collectively on a peer-to-peer basis. So stigma, really, I mean, people consider what the pros and cons are of if I disclose that I've got a mental health condition. The pros obviously are that the behaviours are better understood within the organisation. The support will be provided, and that there's more empathy and understanding towards somebody's behaviours and attitudes. The cons, obviously, people think about the reprisals of actually revealing a mental health condition. The stigma around that mental health, will they be put in that box? And is it career limiting? Do people suddenly think, well, actually, we can't promote so-and-so because they've revealed they've got a mental health condition? So people weigh these options up. And similarly, when they don't disclose a mental health condition, they think, well, actually, the pros of not revealing this is that I'm going to minimize that stigma, if you like, the considered humiliation that revealing we've got a mental health condition they think could reveal. They think that actually I'm not going to hurt my career prospects. Well, actually the opposite is potentially true, because if they're under extreme stress, that is going to in itself affect their career prospects. And then obviously they think that if the cons of don't disclosing is they keep up a pretense. They could be seen as odd or unusual, their behaviours. And unfortunately, they don't get support, and that mental health condition does get worse, and they get to the crisis point, which unfortunately we do see, particularly within construction and transport and logistics. And so at Mates in Mind, we're encouraging all employees to really start the conversation. You know, Mates in Mind is very much about that peer-to-peer approach, looking out for your mates. Everybody can start a conversation with a colleague. You don't have to be a trained professional. We can all speak with open questions and listen non-judgmentally to what's coming back. We don't have to solve the solution. This is not about listening and saying, well, this is what I recommend you should do and how you should do it. It's about listening and listening empathetically. You can comfort that person and help them keep calm, and then you can connect them to the relevant information or support structures that might exist within your organisation, such as an EAP or mental health first aiders. Everybody is able to do this, and you are far more likely to open up and talk about mental health if a close work colleague actually approaches you and asks that question, are you okay? And listen, and ask twice if you're not convinced. No, seriously, are you okay? And start that conversation, listen, and signpost to where people can get support. It's really important that when you are looking out for other people, though, you obviously look after your own mental health. And there are various different guides on how you can do that. I think it's well known now that people's physical health is really important and intrinsically linked to people's mental health. We recommend things like keeping active, obviously, keeping in touch, talk to family, talk to friends, talk to work colleagues, limit, obviously, the use of things like drink. Take a break, try and relax, don't be turned on continually. Very difficult in the current climate, especially if you've been working from home and you've got access to your laptop and your phone. It's all merged into one over the last year. I've found particularly difficult putting the laptop away and not taking a sneaky peek at the weekend as to what emails might have come in. So it's really important to take some downtime and relax for yourself. So as a charity, Mates in Mind, what we do, as I said, is we work with organisations to help them improve their employees' mental health. We do this by working on an assessment basis, so understanding each organisation individually. Everybody's at different maturity levels. Some of the mental health programmes that we see are very advanced and very far in the front. Some people haven't considered or done anything as yet. And so we just need to understand where that organisation is with a quick assessment, understand the policies and procedures and their employee levels of stress risk assessment, for example. We can then help design and plan a rollout of an actual programme, ensuring that the approach is taken in consultation with the organisation so that it's informed and best for your people. The interventions and support structures that we can use, we provide organisations with things such as our Start the Conversation training and communication tools so that the right advice and guidance is there for employees. And then it's really important, again, to benchmark, monitor and review the success of the programme that you implement so that you can see, actually, yeah, we are making progress as an organisation. In the first year, employees didn't feel particularly comfortable speaking about the subject. Year two, it could be that actually we've seen an increased engagement in regard to mental health. We've introduced management training or referrals or brought in an EAP or whatever it may be. You need to measure and monitor that ongoing process. And at the centre of that, what we try to do is have a central team kind of working with the organisation to help steer that group and the programme that they put together. As a charity, we're able to support in various areas depending on what the organisation needs. So it might be that it is a very much starting organisational cultural change that needs to take place. It could be that it is education and awareness. It could be communication. It really is various different things. But as a charity, we're here to support organisations get a really robust programme in place. And just quickly, some of the feedback that we've received from the work that we've done with various different organisations, and the top left is really critical for us. The Mates in Mind sessions have been life-changing. Somebody who hadn't been able to speak about mental health felt that after the course that they went on, they were actually able to open up to relatives and talk about things before it got to a crisis point. Hopefully you found the workshop today useful. Of course, if you've got any concerns for yourself, please do have a look at our website or reach out to any of these support structures and helplines that are available and accessible. But yes, thank you ever so much for the time. I hope you found that useful.
Thanks, Martin.
Thank you.
I think that was very, very interesting and quite timely. I think we're all very aware of our mental health and those around us at the moment. But it's, yeah, I think it's becoming increasingly more difficult to judge the mental health of our colleagues when we're all working so remotely, but or many of us are working so remotely. But while we're now going to open up the floor to some questions. Just saying apologies if some of you had some issues with some of the audio in some of the places, but hopefully it wasn't too badly affected. I think we're having a few issues with the system. There are a lot of you keen to join. So I'll kick you off with a question while we're waiting to see if any come from the floor. So where do you think that mental health would normally sit within an organisation? Would that be within the health and safety function or human resources?
Yeah, and it can be a bit of a funny one. We've seen that mental health sometimes is kind of that proverbial hot potato, in that it does often get passed around from HR to health and safety, and unfortunately it sometimes falls into a gap. What we encourage organisations to do is form a steering committee that's made up of various different areas of the organisation. So representative from HR, representative from health and safety, senior manager, and an employee from the floor level, so that everybody gets to have an input and can actually help craft a plan and have input as to what's happening within the business and where. Obviously, it's great as well to have a lead, so somebody picking that up. And again, that's really up to the size of and the structure of the organisation. But definitely consider having a steering group that's made up of a cross-representation of the organisation.
Thanks, Martin. And we've got a question here. Apologies if I missed it, but what is an EAP?
Sorry, an EAP is an employee assistance program. So a lot of organisations now have provided their employees with a benefit that provides them with various different healthcare services, such as counsellors. It's usually in the form of a helpline. Often what we see with EAPs are they are very useful, but they are underutilised. In fact, the national average use of EAPs is between 1% and 3%. And that's largely because employees don't know that their employer actually is providing an EAP. And secondly, they don't know actually how to contact them. And that's especially true in construction and transport logistics, where a large proportion of the employees are actually on site or in a trailer or in a truck, and they don't have access to things like the intranet. And so a lot of the times actually signposting to the EAP that is available is not particularly well done. And again, that's part of getting the right structures of support in place, because if managers are upskilled to actually know that as an organisation we provide access to an EAP, then when they're having discussions, when they're having the one-to-ones, when they're having various different conversations with their team, they can highlight that the EAP is available for employees and encourage them in the right way to actually reach out to it if they need that support.
Thanks. And we don't generally hear about any instance of poor mental health in the industry. Are there any reasons you think for that?
Yeah, I think there is still a stigma around mental health. What we've seen as a charity, we started working with the construction industry, and they've taken some really great strides in addressing mental health. There is a lot more awareness around it. There are a lot more structures within organisations to support their employees. And obviously within construction, there are a lot of asset and fleet operators that are included within that. With transport and logistics, we've started to work now with some major organisations. We are seeing that they are slightly behind the curve in regard to mental health, and that stigma is very much prevalent still within the sector, and it's not still a subject that is hugely spoken about. So I think there's almost an approach that if it's not spoken about, it's not happening. And also I think that employees are still a little bit concerned about actually opening up and talking about mental health. So I think, as you can see, and we often see it with absence data, the HSE, as per the presentation, kind of estimates that 54% of all absence can be attributed to stress, anxiety, and depression. If you look at most organisations' absence data, that number is usually nowhere near. And so really it is about how can we get employees and employers to actually make the culture open and supportive to actually speak about that mental health issue.
Excellent. We've got a question: are the slides going to be made available afterwards? And we're not going to share the slides, but we have recorded the webinar, and we will put that on the Falls website, and we'll send a link.
Yeah, and please, if anybody has any questions, please don't hesitate in contacting us at Mates in Mind. My email address and our main support email address is on the screen now for you. So if you do have any concerns, worries, or want to actually look at your own organisation structures, please don't hesitate to contact us. And you can actually see that there is an offer available at the moment for Falls members. We are a charity. Our primary objective is to reach and support as many organisations and individuals as we can. Obviously, as you can imagine, as a charity, we provide organisations with the resources and tools to actually start their own programme, and we try to make that as competitive as possible. And for an organisation with less than 50 employees, for 3 years, all inclusive, we can start you with your programme for £350. So we do try to make it as competitive and easy for organisations to get their own programme up and running as possible.
Thanks. So we've got a request for whether you could provide the 10 ways to look after your mental health poster. But shall I put that as one that you'll follow up afterwards?
Yeah, no problem at all.
Perfect. Okay. Well, I think that will now conclude our webinar for today. I hope everybody found that informative. I certainly did. I'd just like to say thank you to Martin and to everyone in the audience for joining us today. And before you go, at the end of this webinar, you'll be automatically sent a feedback survey, or the link will appear. And I just ask that you spend a few minutes giving us your feedback as give you the feedback. As it's a new type of webinar for us, we just want to use your feedback to improve on future events. Oh, one last question, Martin. The audio went funny when you were saying about the price. Did you say £250?
So it's £350.
£350.
Yeah, 3 years inclusive.
Perfect. Thanks, Martin, and thanks everybody, and thank you all for your time this morning. And we'll now bring the webinar to a close. Thanks, then. Goodbye.
Thank you, everyone.